So I think we're going to get started. Thank you all for being here. We have a special treat today. We have with us the one and only Audrey Holland. Brief introduction on Dr. Holland. She is certainly a international authority on aphasia. She's been studying aphasia for quite a while. Her views on aphasia, certainly functional approaches to aphasia assessment and aphasia treatment, have been highly influential on our field. We're very lucky to have her here today talking about some of her latest research. For those of you who don't know, I'm actually I was a Ph.D. student with Dr. Holland. I wasn't sure whether I was going to go for my Ph.D., but I decided that if I could get in with the top person who was doing aphasia research at the time, I would go for it. I applied, and luckily, one of the best things that happened to me was to be accepted to be Audrey Holland's student. Audrey Holland is going to talk to us now about her new assessment paradigm, the famous people paradigm, and I want to welcome her.
It's very nice to be here, and I'm not going to take up my time, which is limited with you, to tell you more than I'm just thrilled to be here. And that's probably the most exciting doctoral student I've ever had in my life. So this is a mutual romance here. I'm going to be talking about assessing and using strategies and tactics for communication in severe aphasia. So the clinical remarks are all going to be geared toward severe aphasia, but I'm going to give you an overview of an approach to looking at well, it's not a test, it's an approach to inventorying some problems that people with mostly severe aphasia have. Other people have this too, but it's the kind of clinical implications for this, I think, are stronger in relation to people with severe aphasia. So I'm going to begin by briefly describing the famous people protocol. Say that 3 times in a row and you will get a special award from me. This is a strength-based approach, and it is, as I said before, a clinical inventory, not a language test. And it looks for communicative, not necessarily linguistic competence. And the whole format of the test is geared to supporting aphasic people's communication right from the start. So this is not a way to inventory what could be going wrong, but more looking at what's right about language and aphasia. And then I'm going to try to discuss some ways that I think it can be applied to treatment, either directly through practice and development of effective communication strategies, but indirectly through the development of highly personalized, relevant vocabulary. I believe it was me who originally said people with aphasia. Yeah, I think I don't even want to think when I said it. I have no idea how long ago it was. But essentially, what I'm trying to say is something that I believe very strongly, and that is that in order to really do a good clinical job with people who have aphasia, we have to look at strengths. We have to look at things that people with aphasia can do, not only at the kind of deficits they have. And I would say one of those strengths is that their communication is, in fact, better than their ability to talk. I'm going to have 3 goals in this talk. One is I'm trying to help, I want to discern whether people with aphasia really can communicate better than they can talk. And in fact, whether they mean it when they always say, as they always do, I know it, but I can't say it. And not only people with aphasia, I would add, but the older my colleagues get, the more frequently I hear it out of my colleagues' mouths as well. And if they do talk, communicate better than they talk, then how do we get them to use the communication strategies to get messages across? And I think that that's the essence of my message. How do we help them also to focus on what language really matters the most for them? So these are not famous people. That's just a bunch of people. But I want to describe for you rather briefly this protocol that we've developed at AphasiaBank, Davida Fromm, Margie Forbes, Brian McWhinney, and I, called the Famous People Protocol. Now, since about yesterday, we've decided to change the scoring system. So much of what I have to say about scoring, I'm going to shove over because we're not really going to be talking too much about that. But what it does is to take a tough task, and in this case, that's retrieving the names of people. And because it has to be people that are well-known, famous people, and invites people with aphasia to do anything they can to communicate who that person is. Now, right away, you can see this is rather different from a typical way to measure word retrieval deficits, when at best you can give one clue or something. This pulls out all the stops. Do whatever you can to get your message across. It's much more like playing charades and also with talking than it is any other. It's much more like a game than a test. And it isn't a test. It's a challenge. Okay, prove to me that you know it but can't say it. Smile, smile. This is a pretty aphasia-friendly experience altogether. And help clinicians to see and to value, along with helping patients to see and value, that what works for them can be taught and can help their patients if clinicians recognize that. So I'm sort of suggesting that both people with aphasia and the people who work with them can use strategies to help people communicate more effectively. So this is the way the protocol runs. If I showed you that picture, and this is actually the way the instructions are all set up for this test. So, okay, I just said test. Don't mean that. If I showed you this person, how many people in this room know who it is? That's a pretty good percentage. I think that's almost everyone. If I showed you that person, and I want to know if you know who he is, you can say his name, or you can write it, or you could name a movie or a couple of movies he was in, or maybe sing a bit of "You Ain't Nothing But a Hound Dog," or I would just say or sing a bit of a song. Or if those things don't work for you, I will start it. So if I say L, I'd give you credit for Elvis, by the way. I mean, there is only one, this famous Elvis, right? So you would get credit on that. Now, the stimuli consist of pictures of 24 famous people. This is a famous person down in that corner. I expect most of you recognize him. And there were 10 entertainers, 4 world figures, 5 athletes, and a partridge in a pear tree. 5 presidents of the United States. Now, originally these were scored 3. We're not going to talk about the scoring system because it's all changing, but there are also a set of 28 related questions that clue people about strategies they might be able to use, gestures, singing, whatever. And full credit on this test would be if you could tell me who that is, in whatever way you can do it. And one of the ways you can do it is by saying, good, very good, lovely, yes, you got him. Tell me another way you might be able to communicate that. What? One of the, whoops. What just happened? Quit.
Yeah, if you go with your mouse to quit. There you go.
Okay. Or you could say moonwalk. You could say pretty sister. Lots of things you could say. And there are in this test, this protocol, pictures of some people who are known by the characters they inhabit. For example, Dorothy, and it's a picture of Judy Garland dressed as Dorothy in The Wizard of Oz, or Clint Eastwood, Dirty Harry. Those would be, I need to tell you this, you need to keep up on your facts about famous people. in order to score this test adequately. So one of the things that I think is a really good idea is if you have any doubt about a score or any doubt about whether that was a correct answer or not, go check with, you know, one of your really good sources like Wikipedia, where you can find most of this information to make sure you're right. So if you give a little partial information, that gets a score too, but it doesn't get as much as the one would give you complete information. And you can use minimal encouragers. You can say, okay, let me help you a little bit with this. This person is, well, you know who she is, right? Are you all getting an A on this test so far? Thought you might be. And then this is where we're going to change. This is the part we're going to not ask about anymore. 1-point items. So who is this? Okay, he'll still be in the test. Don't worry, he's not going away. He doesn't seem to go away anyway. And so the kinds of questions that we might ask about him. Is he famous for rugby? Is he Ben Roethlisberger? Is he Tiger Woods? And those 28 other questions are thrown in there just to be sure that people can give some other ways to communicate. Like, for example, can you sing me a song from The Wizard of Oz? Questions like that. Or can you tell me which sport? Show me which sport each of these people play. So how can you use gestures? How can you use singing? How can you use talking? How can you use part word responses? Time being of the essence, rather than to show you the data, we piloted the pictured stimuli with both aphasic and non-aphasic subjects related to a number of concerns. First question that arises is, can it work for younger as well as older people with aphasia? Well, you just kind of showed me that you guys do pretty well on my little practice items. Can it be used with non-native born Americans? We were lucky enough in running the testing with this protocol to have a chance to go to Canada and test out our famous people protocol with people in Canada. And people in Canada, although they complained, why am I being asked to name the presidents of the United States? They did very well. And the thing they seemed to feel most strongly about was that we get rid of an American football player and stick in a hockey player if we really wanted to make it culturally appropriate. So it does work with people from other cultures. And is it culturally biased toward pop culture? This is what I was particularly worried about, because I was worried about my egghead friends doing well on this test, this measure. Actually, they don't have any trouble with it either. So let me show you some of the data that is available on this test, but from the standpoint of stuff that we're going to simplify. We have a large database of people with severe aphasia and people who have milder aphasias, and a bunch of controls and a bunch of pilots. I'm going to be talking primarily about the 36 people whose WOB score, we also did WOB on every one of these, was below the mean of our sample, which was below 60. The mean was 36.2, with that nice huge deviation, standard deviation that we so frequently find in aphasic people. And the WOB-R and the FPP scores were moderately correlated. A weak relationship between severity and older age was also found. Neither of these should come as a big surprise to anybody, but to show you how the groups differ from each other, these are box plots, and the top box plot is the mean FPP score for people with severe aphasia, and the mean score in that test, this was out of 100 points, the way it was figured then, was 54.6, with the standard deviation, again, a big standard deviation of 21, but a range on this test from 21 to 94. And these are the vertical lines on the box plot are the percentiles. So you can see that the bulk of the people were between 40 and 80 on this test. Non-aphasics, you can see we're up there in the the lowest one in this this sample actually was 78 to 100, with everybody clustering up toward the 100. So this is a pretty easy measure for people who don't have problems. But I want to give you some examples of some of the kinds of responses that people made. Full credit responses and partial credit responses. Clint Eastwood or Eastwood, verbal responses like Elvis Presley, as you did, circumlocutions. She's the one with the dog Toto and those guys. That would probably clue most people in that that was a picture of Judy Garland. And my favorite, I think my favorite response in the whole thing was a woman with conduction aphasia who said, Bingles, bungles, bongles, Beatles. And we would have all recognized it from Bingles, Bungles, I think. But anyway, she finally got to Beatles. Or good descriptions like lots of diamonds, lots of husbands, National Velvet. Written responses were the second most common that people used in this test. And they could be either part or whole word writing, scored as above. And one of my other favorite responses was a gestural one, which was a gentleman who had a love AQ of 18, and he was an incredible strategizer. He drew a picture of a grate, and then he stood up and went like this and cracked me up. I mean, it was so clearly Marilyn Monroe by this big, big man doing this wonderful little. And it was not that iconic 7-year itch picture that was in the test. It was a portrait of Marilyn Monroe. Marilyn Monroe figures big in these examples. Happy birthday to you. Happy birthday, Mr. President. That was a very common response to Marilyn Monroe. Very few people that we saw used any kind of speech generating device or alternative communication device, although they were encouraged to do this. In this particular group of people, we had very few people who had either been trained or took advantage. We had one woman who brought in her SGD, and I kept pointing to it. She never used it in this test. I think that says a lot about the ability to necessarily see that it's a communicative device. Combinations of modalities. Lots of people would draw a map of her home state saying funny none. That was a response somebody gave to Whoopi Goldberg. But what does it all mean? I think it addresses the point that language and communication aren't the same thing. It also suggests that there is merit in helping people with aphasia, especially those with more severe aphasias, to recognize, honor, practice, and be comfortable with using the strategies that work for them when they are really attempting to communicate to you that they know it, even if they can't say it. Now, I'm a bear on this point because I think that unless clinicians help people to recognize that, it isn't really going to get through to them. So I'm going to be talking from here on in about how some of the things we can do to make that sort of thing more typical or more honored and more practiced by people with aphasia by our own recognition of some ways in which that recognizes strength. So how can we encourage and facilitate people with aphasia to use their strategies? And if they've had this little protocol, you have some kind of a nice inventory of what might possibly work for proving that they know it if they can't say it. I'm a groupie. I really have mostly abandoned my long-term interest in one-to-one communication and one-to-one therapy for the advantages, the extra advantages that come with working with groups. And I am biased in that I see many of these activities as perfect for groups. They're not only perfect for groups, but I think they I mean, they're not only good for groups, but I think they show their strengths there. So I'm suggesting that one kind of group activity that one might use is the same formula, literally the same formula for stimuli as used in the FPP itself are appropriate. So I'm milking Google image. I think it's just a magnificent tool for speech therapists. Famous places, stacks of pictures of famous places, heroes, breeds of dogs, makes of cars, Italian foods, garden tools, I don't care what, but stacks of pictures of that sort of object, those sorts of things, and using them kind of in a different way than we're used to using them. The difference lies in the responses we expect of a group. For example, if everyone has been given the famous people protocol, or where there is some good record of strategies that work for that person, yet the instructions are that each participant in this group is instructed to respond with his or her strongest, most useful strategy. So that could be in one case, part word writing, in another case, gesturing, in another case, just saying what you can of it and we'll figure it out. So either their own strategy or a verbal response becomes part of the person who's understanding it too. So if I would gesture the lady on the grate, if I would gesture Marilyn Monroe and your strength was part word writing and you wrote MM, that would be a successful interchange between the two of you. Does that make sense? So the goals of the session like this are simply to practice in a somewhat naturalistic setting, using the strategies to communicate and getting feedback as to their success. And this can work with anybody, but from my perspective, it seems particularly potent to use this with other people who have language problems as well in a group. I don't mean to denigrate individual sessions. I think these things work very well in individual sessions. And the example I have prepared here is from PACE. And you know, in a PACE activity, there's a barrier, and you're on either side of the barrier, and you each have the same set of cards, same type of cards. You each have the same pictures. You each have your own set. Emoticons, another very, very useful thing for working with people with aphasia. In this case, there are 9 emoticons in front of each, the therapist and the aphasic person, and they take turns. So the clinician starts by saying, you can remember what pictures are. You have some idea what those pictures were. The clinician says, a big hairy spider walks across my iPad. What do I feel? Find the emotion, show me it across the barrier. Your turn. Show me what this is to the patient. Show me one of the emotions in front of you. This is where he's not supposed to pick up the card and hold it up to you. He's instructed to show you on his face one of the emotions. And so let's say he picks up the happy face. He decides to do the happy face and he smiles. And the clinician says, did you just win the lottery? Or something like that. Shakes his head no. He says, oh, did you just become a grandpa? Something like that. I mean, this would be the form. In that case, facial expressions to send your message across the barrier. I like to do scripting, and I know that that's something that is done here. So here's an example of a totally apocryphal scripting example. The Steelers beat the New England Patriots. The Steelers beat New England 44-27. Ben Roethlisberger threw 4 touchdown passes, and Pittsburgh fans went wild. Ah, what a lovely thought. Okay. Your aphasic person is a big talker. Her predominant tactic is giving relevant words, and she's a football fan. And she is trying to communicate that message to her husband, who somehow or other, probably was a Patriots fan, slept through the game. So what are the relevant words? What are the relevant concepts? Does the order matter? Almost all of those words, if you think about it, have other words that could be substituted. And that's a strategy that works well too. Pittsburgh for Steelers, Patriots for New England, et cetera, et cetera, et cetera. She doesn't have to communicate a whole bunch of stuff, but she can use, and she doesn't have to maintain any order, but she can eliminate details and get the big message across. So that would be an example from scripting. David Buchelman recently pointed out that not only is the world becoming more dependent on reading and writing, if not correctly spelling, for normal communication. So all you need to do is to witness texting, tweeting, et cetera, to see how that has become an important part of the genre of communicating of this generation. He also pointed out the growing importance of images in normal communication. Witness selfies and other image captures. I was not long ago in Vietnam and spending some time going to temples in, actually it was in Cambodia, and many narrow passageways within the temples. And people would be standing in the door, on the sides of the temple walls, taking selfies like this, so that people had to line up to pass the people who were taking selfies. And it probably made me more aware of selfies and their importance in communication than almost anything I'd ever seen before. To say nothing made me a little annoyed. I recognize the power for some people with aphasia to use SGDs, although in my sample I didn't have any, or other communication devices. However, I would like to point out to you the power of a tablet and a smartphone across the aphasic spectrum. I don't think they can be overestimated. I did this little exercise with myself a couple of weeks ago, and I just went to Google Images and I typed in at the top, Paris, tall, iron, fed it into Google Images, both pictures and words. Both pictures and the words Eiffel Tower came up. That's part of an object lesson for you. And I then did dog, hunt, blood, and boom, up comes a bloodhound. This is a real strong way to communicate. And I think the shocker to me was that I pulled up Moonwalk, and before I got a picture of an astronaut, I got Michael Jackson. Now, those kinds of strategies are certainly easier than drawing for people who can access related terms, either by talking, thank you, Siri, or by writing. There are, by the way, I'm having a wonderful time trying to teach my Alexa to repeat without having to say, Simon says. I'm getting there, but that'd be a wonderful way for people to work on word repetition instead of sitting around and taking clinical time doing that. I want to give you a little example here of one of my favorite people with aphasia, whom I'm going to call Jose. And I was doing a session in a group he was in which we were looking at a picture of Guess Who, and Jose, who is a movie buff, he has very, very, very limited speech, but he's a movie buff. And he looked at that picture of Clint Eastwood and said, mule. And I thought, mule? I said, mule train? Was Clint Eastwood actually in Mule Train? No. The rest of the group, none of us could get it. I saw some people out here who did get it. None of his group, including me, got it. So Jose is not one to be deterred. he said at the end of the session. And I thought, next week I'm going to find out. And next week, Jose walks in and hands me a picture of Clint Eastwood and Shirley MacLaine on a mule, and click. Two Mules for Sister Sarah is the movie that he was talking about, and he was absolutely right. I tell you that story because this is the way this guy communicates. Major way of communicating is with pictures, and I want to show you how he does it. Jose and Ellen, his wife, are joined at the hip. They're a marvelous, wonderful couple. And Ellen comes home from work on a typical day, and she says, "Hard day, Jose. I'm tired. Let's go out for dinner. How did you spend your day?" Jose gets out his iPhone. "Oh," she says, "you went to the Home Depot. Did you get the wheelbarrow we needed?" "Yeah," says Jose. Did you go anywhere else?" "Oh," she says, "you went out to the ranch. Everything okay out at the ranch?" "Yeah, well, she says, "Did you kill it?" Jose says, "Nah." And she says, "Glad it was you, not me." And then he brings up a new picture. Okay. And she says, "Aha, you went to watch Manny Jr. work out." Jose says, "Yeah. Was he pleased to see his grandpa?" Jose shrugs. It's elegant communication. And I did not teach him this. This all is Jose. And this is just the way he gets through his world. He has taught me, I think, one of the most powerful lessons I've ever heard about aphasic communication. And I just wanted to share that with you. I'm going to skip a few things, and I just want to say a few words about personalized vocabularies. And suggesting to you that if you use workbooks, throw them away. Just don't use them anymore. And non-customized apps, to me, fall into the same territory. Finding out what constitutes personally relevant words and concepts is really where the action should be. And you will never know if you don't ask. Families, people with aphasia themselves, particularly with severe aphasia. When you pick the words or concepts, you are doing clinician-oriented therapy, and I believe you should be doing client-oriented therapy. Personal approaches should be obvious for people whose language is likely to deteriorate, like people with ALS, primary, you know what I mean, progressive apraxia of speech, which I didn't mean to demonstrate, ALS and so forth and so on. But I think it also applies to people whose course tends toward improvement. When you consider the very limited amount of time we have to work with patients in most typical settings, I think it's important to concentrate both your and their clinical energies on language they can use. So use your own work to model how people with particularly severe aphasia and their families can practice productively after funding runs out. So get them involved in the task of coming up with what words matter, get them to make the stimulus material available. I think that's something that we should really seriously do. I know that folks nouns and adjectives, but for me, they're the heart and soul of practical treatment. But I also want to just put in one fast plug, and then I'm going to stop talking, for an old technique called melodic intonation therapy, by introducing to them the concept of personalized vocabularies. And this is a little short story that I won't spend too much time on. But I was working with a man who was an ex-priest. He had had a stroke when he was a missionary in Ethiopia, and very severe aphasia and very severe apraxia of speech. And he came back to town and was living in a retirement community for ex-religious figures. And he was brought into therapy with his brother, his real brother. And I was going to do melodic intonation therapy with him. This was some time ago, but this exam was so instructive. So I said to them, I explained, I want you to go home and next week come in with 3 sentences that Father Bill would like to learn. Here are the 3 sentences. The flag is tearing. How are your puppies? And Brother Cyril did it. No, it's not from some Italian murder mystery in a monastery. Each one of these has a story. Father Bill was very upset about the flag and the flagpole in front of his retirement community, which was in shreds. And he was trying to get somebody, and he couldn't talk. I mean, this guy had really severe problems. He wanted a new flag. That's the sentence he chose. They worked it out together. How are your puppies? The cook at the institution had a puppy, a dog, who had a litter of puppies. And Father Bill, a conniving, nefarious man as he was trying to get one of those puppies for his own. Hence, how do you convince the guy that you're interested in the puppies? Well, you every day say, how are your puppies? And Brother Cyril actually was a kindly man who did many, many kindnesses for other people. And Father Bill had the sense that nobody ever properly thanked him. Now, I share those sentences with you because they're in my head. They're deep in my head because that's personalized language that none of us would have ever thought of. I mean, I was thinking, what have I done? What have I done? Have I stopped being able to communicate? I do have efficacy data, however. The flag is replaced. Father Bill got a puppy. And he named his puppy Shayla, which we all tried to correct. Everybody tried to correct it to Sheila. The dog's name was Shayla, and he finally convinced us that this is the Amharic word for servant of the servant of God. And so it says my audio connection has been lost. I just wanted to end on that. Just to stop. So, questions?
Questions from the room. I'm going to just repeat.
Okay. Questions from you? Yes.
I wanted to know how old your patient Jose was, and did he have those images on his phone stored, or did he pull them up every time he wanted to say something?
No, he took his. It's a very good question. He was, I would say, Jose is probably late 60s, early 70s. His iPhone is his most important tool in life. He uses his iPhone like I use my mouth. Everything, he just takes pictures all day long. I simplified what he was really doing, but that's the kind of, those are good questions. Yeah, I believe probably used the iPhone beforehand, but I never really thought about it. Because they were very, very media conscious people, let me put it that way.
How did you find out about that these were important to that patient? Was it family members?
His brother.
Okay.
His brother, I gave the assignment to both of them. I guess I didn't make that clear. I said, the two of you come up with two or three sentences. I mean, I was more questioning. I didn't know if it was my sanity. I was questioning the brother's sanity. Father Bill seemed very happy with these 3 sentences. But before I taught them, I really thought it was where they came from and what I was doing in trying to deal with them in a lot of patient care. That's another reason, by the way, for involving the family.
Okay. And it's sad to say, but in our work in inpatient rehab, there's so many patients that we have that families don't show up, or they just kind of abandon their family member, and that makes it hard, especially when they can't talk. So,
Yes, but I think that to the extent possible, you need, I mean, I really think if anybody's going to make a significant recovery from aphasia, he is much more likely to do that if he lives in a supportive environment. And so that, to me, is an ingredient of treatment. And as best as you can, find out as much as you can about the patients otherwise. Please.
So a couple of things. You talked a little bit about recovery. So can you touch on how you see recovery in acute care and in chronic stroke differently? Or are you just talking about the same thing? The other thing, you touched on assisted communication devices. My experience is that most people don't want to use them. And I just wanted to get your take on that.
Okay, let me deal with the first one. I think this kind of an approach has to start early. And I say that because I think what really needs to happen as early as possible in therapy is that the family and the patient both see some need to bend, some need to know that things are not going to get worse, everything else being equal, and that they are part of a team. And to the extent that that's possible, that's important. In relation to the other question about devices, I think that it's as devices become more personalized, and I think that's happening. I think that more people are seeming to be interested in using them. But I don't think that they should be substituted for, let's use the the new technologies that everybody is using as a first step. I think that leads into speech-generating devices too. I mean, when you get comfortable with, with some of the kids that your grandkids are going to teach you, some of the stuff that your grandkids are going to teach you to use, that, and that's a very good motivation, by the way. But I think that makes it simpler to go into speech-generating devices and other notation. I don't feel very strongly that drill work on a computer is any more valuable than drill work not on a computer, which I don't think is very biased.
So did you do some specific communication partner training, or is it mostly they're sitting in with you and?
I think it's critical to do communication partner training. I see everybody's therapy team, to the extent possible, as being like three-layered. It's the person with the aphasia, the family, and the therapist. So it's kind of like a three-legged stool. Mm-hmm. And if one of the legs isn't there, things aren't going to work so well. So
they're in therapy with
that's supportive communication, I think this is the other side of supportive communication. This is the patient side of supportive communication.
One more.
Yeah.
So you touched also on this a little bit. It seems to me that with the clinical trials that have shown that aphasia therapy is effective with nice effect sizes, the amount of therapy that people need, we don't get it here in the United States. In other countries, you get plenty of access to therapy, but here, for some reason, we don't like to pay for people to get better. Do you think therefore, do you think that then, like constant therapy and those programs that people can now access online, so computerized aphasia treatment, do you think that that's then where we should be going?
No. I don't think they should be ignored. I think that particularly as many of those approaches to aphasia treatment are becoming more and more personalized. And I know that's true of Graphica, and I think it's becoming more true of constant therapy, where there is no set vocabulary. It's what you decide you want to have to work on. I think that's a critical step for them to become really useful. And again, I think, you were talking to me about this morning, and it looks like any therapy is better than no therapy. And so I'm not going to put it down from those standpoints either, but I think it's a world that's changing and becoming far more interesting.
Thank you.